My name is Iris Zink. I have been a rheumatology nurse practitioner for the last 25 plus years. I own a clinic in East Lansing, Michigan with my husband, Christopher Title. We opened a clinic in 2016 to serve the underserved. So we have a Medicaid-based rheumatology clinic in East Lansing, Michigan. Today, we're going to talk about the mechanism of action of Deucravacitinib, the TYK2 STAT signaling pathway. So Deucravacitinib is the first in-class oral selective allosteric inhibitor of TYK2, a kinase required for interleukin 12, interleukin 23, and type I interferon signaling. So let's break that down. What did I just say? So tyrosine kinase 2 is a member of the Janus kinase family. There's the sisters JAK1, JAK2, JAK3, and TYK2, which are structurally different with different cytokine binding profiles and downstream effects on the immune system pathways. Previously, when we've talked about pathogenesis, we've talked about the TNF inhibitors. Remember, the TNF inhibitors had these fabulous arms on them, and then they had the FC region. And the TNF inhibitors spin through the bloodstream, picking up tumor necrosis factor alpha to decrease the cytokine production in your body. And what is a cytokine? Well, whenever we talk about cytokines, I always talk about my 6 daughters. Cytokines are hormone-like proteins that are constantly in communication with other hormone-like proteins. That is a great description for my daughters. My daughters are always on the Instagram or the Snapchat or the Facebook or TikTok or something, pulling each other into the drama of their lives. And that's what cytokines do. They message each other to get the drama building up in the body, whether it's in the bloodstream or it's in the skin for psoriasis, creating more drama or inflammation in the body. So that's what a simple explanation of a cytokine is. Tyrosine kinase 2 or TYK2s are structurally different and they also work differently. So there's a cell surface membrane that's outside the cell, right? So there's these 2 arms that are outside the cell. And these 2 arms receive either interleukin 23, type I interferon, or interleukin 12. So we have the cell surface membrane. It's either B cell or T cell. And below the cell surface membrane are my legs. And then on my feet are a pair of shoes. And in this instance, we're going to use my Katy Perry shoes. So we have a JAK1 or a JAK2, so 1 or 2, that pairs up with a TYK2 inhibitor. So these are still a pair of shoes, even though they're different. So when this pairing occurs, JAK1 or JAK2 with TYK2, then this pairing occurs, it's a dimerization or phosphorylation, okay? So that pairing occurs and that sends a signal, the STAT signal, up to the nucleus of the cell, which affects the cell's production of downstream cytokines. This is where they think that actually interleukin 17 comes into play because the downstream cytokines promote more interleukin 17 inhibitor, which we know is very important in the treatment of psoriatic arthritis and psoriasis as well. Interleukin 12 and 23 activate immune cells that drive inflammatory processes in psoriatic arthritis and in psoriasis. Interleukin or type I interferon promotes an overactive immune response and are key cytokines responsible for B cell and T cell differentiation as well as antibody production. This cyclical cytokine production activates myeloid dendritic cells to release interleukins and activate T cells, which drive more inflammation and proliferation of keratinocytes, causing excess skin proliferation. Normally, we turn over our skin every 30 days, but individuals with psoriasis, they turn over their skin about every 7 days because they have these huge plaque formation of skin building up, which is the psoriasis plaques. Why is interleukin 23 important? Individuals with higher levels of interleukin 23 cytokines were found to have higher disease activity. Cytokine proliferation also leads to pathological bone deposition via osteoblastic activity. We all learned about osteoblasts and osteoclasts when we studied osteoporosis. In spondyloarthropathy, it's the osteoblastic pathological activity that creates these syndesmophytes and these bone bridging that we sometimes see in psoriatic arthritis patients. Pathological osteoclastic activity causes those bony erosions that we're also very familiar with. So what makes a TYK2 special? TYK2 only proliferates interleukin 23, interleukin 12, and type I interferon, and binds to the regulatory domain of the pair. So let's back that up. So every cell has a regulatory domain and a catalytic domain, or a kinase domain. So JAK inhibitors bind up to the catalytic domain, which can have off-target effects, accidental effects, if you will, or affecting blood development, metabolic activity, and lipid metabolism. It works kind of like a parking spot. So let's talk about that. Have you ever been waiting for a parking spot and someone comes in the other direction and whips into the parking spot? That's kind of what a TYK2 does, is it blocks that parking spot so that other cytokines can't bind there to create this downstream activity. So we want to talk now about allosteric binding versus orthosteric binding. This is going to come up in practice, and the pharmaceutical people are going to talk to you about it. So it's really important that you understand these two different concepts. Protein kinases are made up of two domains, like I just said, the active catalytic domain and the regulatory or pseudokinase domain. I don't know if you know what a catalytic converter was. I had my husband re-explain it to me yesterday. I remember, but I just wanted to make sure I remembered. So unleaded gas still has some lead in it, right? So the catalytic converter attaches to your tailpipe to pick up any extra lead that might be coming through the engine before it goes into the environment. It doesn't take away all the lead, but it's more like a filter. So that's what a catalytic connection is sort of like. It's like a filter. It's not like a plug. Orthostatic binding commonly refers to the binding at the active site of the proteins, thereby facilitating response and activity. That's normal binding for JAK inhibitors. Allosteric binding refers to binding at a site other than the active binding site to modulate the activity of a protein. So let's make this more simple, because these are important concepts that you understand. So you and I are going to go shopping at Macy's because Mama needs some new shoes, okay? So we're going shopping at Macy's. So here's my Macy's store that I drew earlier, right? So when I go shopping at Macy's, I park right next to the door in one of the JAK 1, JAK 2, or JAK 3 spots, and that is orthostatic parking. So I'm getting in, I'm getting out. It's still effective. I get my business done, but there's risks associated with parking right by the door, right? There's these trees here. Birds can poop on my car. It's possible that somebody comes in and they bang my key out, right? So it's possible that somebody comes in and sees that I have something on the passenger seat and they steal my stuff because I'm so close to the door. So there's risks associated with parking orthosterically. My husband, he has a big fancy Raptor truck and he doesn't want anybody parking anywhere near him. So he parks way out here. So he is an allosteric parker. So he parks out there because it decreases the risk. So allosteric means that it's more specific to the binding site, and so there's less off-target effects of that. My orthostatic parking is fine, but it comes with potential risks. His allosteric parking, which is way over, it goes through the other side door of Macy's and everything. It eliminates some of the risks and only affects the immune system, avoiding any of those off-target effects. Many of the pharmaceutical companies are looking into allosteric binding agents that have distinct regulatory sites that, when bound by a molecule, can modulate the activity without directly interfering with the primary function of the protein. Allosteric binding is being recognized because it's more specific and more selective and less disruptive manner of binding than traditional orthosteric drugs. So in summary, TYK2 is like a switch in the immune system that can get stuck in the on position in autoimmune disease. By blocking the TYK2 parking spot and by allosteric binding, this newly developed therapy can turn down the overactive immune response, providing relief to the inflammatory symptoms of psoriatic arthritis, such as dactylitis, enthesitis, and joint pain, as well as the hyperproliferation of psoriasis. Thereby, they effectively control inflammation without affecting unintended targets or shutting down the immune system completely. If you want any more information about TYK2 inhibitor or about Deucravacitinib, please visit the RhAPP website. Thank you so much.